Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self at KMET 1490 AM BC Radio Live. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist. And I'm offering this program with my colleague and business partner, Dr. Robert Jaffe, who's a psychotherapist as well as certified hypnotherapist. And he's going to offer a program on codependency, addictions, trauma, or impacting relationships. And, we're talking about codependency, a never ending topic. Welcome, Dr. Jaffe.
A never-ending topic. Yes, thank you very much for that nice introduction.
My pleasure.
I'm Dr. Robert Jaffe. Been in private practice full-time since 1984, and I specialize in the treatment of addictions, of which codependency is the most common, and it's also the most it's the biggest addiction that is not talked about. People generally are not aware that they are in a codependent relationship, or that they suffer from codependent characteristics. And what we know in therapy is that actually there's a book, I think it's by John Gray, it's called What You Feel You Can Heal. And so we know that you can't heal something until you become aware of it, and often we become aware of it through our feelings, through our emotions. Our emotions are there to inform us, and our emotions are there to motivate us. So with our emotions, we get information about ourselves, about others, and about the world. And with those emotions, or people call them feelings, we call feelings or emotions, with those emotions, we determine whether we are safe or whether we are unsafe, and whether we want to move forward or we want to stay still or we want to run away. All those emotions are there to give us information and to motivate us. And so without our emotions, we're pretty lost. We still have a very powerful intellect, excuse me, and our intellect can guide us to an extent, but our intellect is limited in that it doesn't really give us the motivation that we need to make any adjustments or changes in our life. What does that is our feelings. We want to change because we want to feel better about something. We want to change because we want to solve a problem which is going to make our life easier. We want to change because we care about somebody, and trying to understand them makes us uncomfortable. If we don't understand them and they're unhappy, that makes us uncomfortable. So we want to change. We want to figure out how can I do this differently so that I can feel better, and I can maybe do that by helping my friend or my partner feel better. These are all done at the emotional level, and the emotions come from us from our subconscious. We don't get up in the morning usually and say, today I'm going to feel sad, or today I'm going to feel happy. I mean, some people do have that mantra, and they try to act as cheerleaders for themselves. That's fine, but you don't actually consciously make that change by saying, I'm going to be happy, I'm going to be happy, I'm going to be happy. It doesn't work that way. There's probably millions of neurons that are processing what's going on in your life, and the sum total of all of that gets served up to you as a feeling. So understanding our feelings and understanding what our feelings are telling us is essential if we really want to learn how to be happier overall and how to create more happiness for others in our life.
I think, this is a very important point. And, I do have clients and actually, people, friends that they ask me, what do you mean by emotions running us? Our brain is running us.
Mm-hmm.
What do we say to that?
We say our brain carries within it uh, the it carries within it thoughts and feelings and processes. That's what our brain is there for: thoughts, feelings, and processes. So, what is a process? A process is it is the chemicals that go on inside of us so that our urinary tract still functions and so that we can excrete urine, so that we can digest, so that we can breathe in oxygen and exhale nitrogen. So all of that are processes in our brain. Then also our brain informs our thoughts. So we have a thought, oh, I want ice cream. Well, where did that come from? It came from our brain, right? So thoughts, processes, and then emotions. So when we're with someone and that person is smiling at us and talking lovingly to us, we have a feeling in our body about that. That comes from our brain, right? And so our brain, yes, our brain is instrumental in those things. Um, we also have a soul, which is actually it's not a physical thing; it's an energetic thing. But our soul is there to help us achieve our life meaning and and our life journey. And there are people who says, well, how do you know you have a soul, right? How can you tell? And that kind of comes back to the poem of Footprints in the Sand, sort of like if it looks like a duck and it quacks like a duck and it waddles like a duck, probably a duck.
Sounds like a dog.
Sounds like a duck, probably a duck. And so what we have is evidence that life has meaning that comes to us very, very early, and that evidence is certainly evident. It's certainly an example of that is people who come in with musical abilities, right? People come in with athletic abilities. People come in with philosophical abilities, and where did that come from, right? If it's just the brain, then you would imagine we come in as a blank slate. So there has to be something more than that. At least that's my belief, and everything that I've read about it leads me to that belief. So the question that you said is when a client says it's our brain, yeah, our brain is a big part of it. Our brain isn't all of it, but our brain is a big part of it. But our brain creates a lot of the things that are meaningful to us in our life. Our brain creates the chemical processes that run our bodies. Our brain has creativity, so we can create with our brain. You're a wonderful artist. You use your brain to create artistically. Um, and also as a therapist, we use our brain not to just recite what we've read in a book or what we've learned in a seminar, but we integrate all that information and then we put it out as what we think, feel, and believe. And our brain does all of that for us. So, but one of the main things our brain does is it creates the emotions, right? Emotions generally come from beliefs and thoughts that we've had over a period of time.
Exactly.
Right.
Yes.
So
all those information that you are stored in our synapses.
Exactly. Right. How they're stored, we don't know. We just know that they're there.
That's what the brain does. It stores information.
It stores information, and then it does a lot more than just store information, right? We just talked about some of the other things.
One function of it is.
Yeah. So, but this program, in this program, we're talking about addictions, we're talking about trauma, and we're talking about relationships and codependence. And codependence, as we started off today, codependence is one of the biggest addictions. And what does it mean to say that codependence is an addiction? It means that it fits the definition of what we've talked about as what addictions are. So the book that I used, that I recommend to people to read and to get more information and to understand more about codependence, and that I've used throughout these programs, is called Codependence: Healing the Human Condition. It's by Charles Whitfield. He's a medical doctor. He wrote this back in the 90s, and it's still like the Bible for codependence. And he says, okay, so what are the cardinal characteristics of codependence? So I'm going to tell you basically what he says that those are. The first one is it's learned and acquired.
Mhm.
It's learned and acquired, which means that we're not born codependent,
No.
right? So we don't come out of the womb and then we take our first breath and then we're codependent. What we are when we're born is dependent, right? We're dependent, meaning that we cannot meet our own needs. Um, we can meet our needs as far as being able to breathe on our own, hopefully, if there's no problem. We can meet our needs as far as sucking in sustenance. We can meet our needs as far as digesting and excreting the parts. So in those basic ways we can, but we can't meet our needs in terms of getting sustenance for ourselves. We cannot meet our needs in terms of feeling comfortable by being dry because we will wet ourselves and we can't change ourselves. We will and so we can't meet our physical needs. We also can't meet our emotional needs, right? So what are a baby's or an infant's emotional needs? What is the base? What do you think the basic emotional need is?
Safety.
Exactly, exactly. So we are born with a survival instinct, right? And so what we've learned is the two things that babies respond to with fear automatically when they're born is fear of falling, right, and fear of loud noises,
Right.
right. So those are the two things we're born with. Now, we have other fears that are acquired, and we learn about the things that are unsafe. But the baby basically needs to feel safe, and the physical safety of the baby is informed by their environment.
Mhm.
So if the people around them are talking softly, are not talking at them, but are talking in a melodious way, in a melody, if they're talking gently, if they have a lilt to their voice, I'm so happy to see you. I'm so happy you're here. Oh my God, I've been waiting so long. They're not going to understand the words, but they will understand the melody, right? And then if somebody is talking to them like this, and well, good. Now we have to wrap you up, and now what do we have to do, doctor? And they're hearing the voice tone, right?
Yeah.
Now the voice tone may not frighten them, but it may not also reassure them that they're safe. So
And we think babies don't understand. Babies are just babies, and
ex-
but babies come in with billions and trillions and above that sense of awareness and feelings that they're just ready to, kind of soak in everything they can get to survive.
exactly,
You know.
exactly. So yeah, so I'm going to go over these basic ideas of what constitutes codependence. We'll go over them. We'll talk about them, and then as we do, we're hopeful that you will recognize someone in your life or yourself, and then you'll call in or email us and let us know what you're thinking about this program because we're doing it for you. So please stay with us. We'll be back in a couple of moments and see you soon.
951-922-3532. 90 AM ABC News Radio Live. We are talking about codependency and what causes that with Dr. Robert Jaffe. And here we are. And we would like to invite you to please call us 951-922-3532. If you know of somebody that you believe can benefit from this program, please introduce us to them. And we do value you and we do appreciate you spending your hour with us. And your information is going to help not only us, but so many other people out there that they need to hear from you and your story. So, because you may have shared the stories as well. So codependency applies to many, many, many people without even knowing. So let's follow up with Dr. Robert Jaffe to see what else is there
Mm-hmm.
for
for
codependency.
codependency. So yeah, so we were talking about what the baby's needs when the baby comes into the world, and you said safety, and that's the most important need, and of course that pretty much remains the most important need for us throughout our life,
Exactly.
right? So we want to make sure that we're safe. First and foremost, we have to be physically safe.
Exactly, and that's, Maslow in his pyramid says that, the basic needs in a sense of safety is right there.
Is the bottom line.
As a bottom line,
Yeah,
yes. So
yeah.
whether we are an infant, whether we are a child, whether we are a newborn, whether we are an elderly, that sense of safety is essential across our lifespan.
Exactly. And it starts, of course, with physical safety.
Right.
Now, once physical safety becomes assured, and we're no longer in physical danger of getting injured or dying, then we go to we move into what I'm going to say is emotional connection, or not actually emotional safety, but it is sort of like emotional safety in that when we're engaging with another person, if that person isn't being friendly to us, isn't being nice and kind to us, we don't feel good. That isn't exactly the same as where we feel physically threatened, but we don't feel comfortable, because what we want is to feel a connection, a loving connection with other people. That, I believe, comes to us through our humanity. I think I'm not going to say every single human being who's ever been born wants that. I don't know that for a fact, but I think that if we're talking about generalities, the vast majority of people want that. They want to feel loved. They want to feel loved, and they want to feel that sense that other people care about them and want the best for them.
Well, yeah, that's the sense of belong to.
Sense of belonging.
So sense of belong to or belonging is a sense that gives us safety, actually. That it tells us, I'm valued, I'm important, I'm recognized, I'm connected, and then that's who we are as human being. As human being, we cannot live a life that's disconnected. Right. We need to be connected. We need to feel we are connected.
Right.
We need to feel that I matter, and then if we don't have that's one aspect, one important aspect of sense of safety.
Right. And so the first, we go through different developmental stages, and that's the second quality of codependency. It is the first one, it's learned and acquired. The second is it's developmental. Well, what do we mean by that? Well, I'm going to say a sentence on it, because I want to go through. There's a number of these. There's 12 of these that Dr. Whitfield writes about, and so basically, when we say developmental, the three basic stages that we go through developmentally are: we're dependent, we're independent, and then we're interdependent. The third stage, interdependence, means that we are still dependent, but for the most part, we're independent. So what do I mean when we say we're still dependent? Well, I don't know about you guys, but when if I want water, I go to the sink and I turn on the faucet, or I go to the cooler and I push the button, right? Or if I want to, I can go to the stream and put a cup in the stream and get some water. But most of the time, I turn on the faucet. Well, somebody had to build the aqueduct, and somebody had to build the pipes in order for me to turn on the faucet. I don't do that myself. When I get dressed in the morning, the clothing that I put on, I didn't make. So am I dependent on other people to make my clothing for me? To the extent that I don't make my own clothing, the answer is yes. The building that I'm sitting in right now, I didn't build. I didn't, the fact that I'm nice and cool in the building and there's air conditioning in here, I didn't install that.
Right.
So we have so many ways in which we are dependent on other people. We don't think about it because we take it for granted.
Right.
But it's true, right? But for the most part in our lives as human beings, we've learned that we can take care of ourselves given the circumstances that we're in. So we become independent, but we still have that dependency part of us attached to us. Then, as we grow older and we want to connect with another person in an intimate way, then we intertwine our lives with that person and we become interdependent, right? So that means that we take care of ourselves most of the time. And there are times when we get sick, there are times when we're overwhelmed and we ask the other person to help take care of us. And they do that. They do that for us, we do that for them. So that's what we mean when we say that codependency is developmental. It means that there's something that happened in our development that didn't work correctly.
Exactly.
And so what it created then was too much dependence on other people and on outside things, and not enough independence. So that's part of what we look at when we make the diagnosis of codependency. The third part is it's outer focused. It's outer focused. Well, what does it mean that it's outer focused? It means that we're looking for things that are outside of our physical selves and our emotional selves to make us happy. What is wrong with looking to the fact that I'm going to go to Magic Mountain next week with my kid, and the kid's going to be on the rides, and the kid's going to be happy, and I'm going to be with the kid, and I get to go on the rides and being happy about that? What's wrong with that? That's an outer focus thing. The answer is nothing. There's nothing wrong with that. There's not wrong to be outer focused. And however, if you are relying on things that are outer focused entirely, then you're setting yourself up for disappointment because you don't have anything else as a backup to make yourself feel okay, other than the things that are outside of you, which may or may not occur. So you're not relying on yourself, you're relying on things outside of you to make you happy. Those things can make you happy temporarily, and there's nothing wrong with them. It's a question of degree. It's not whether we should or shouldn't have things outside of ourselves. We all do have things outside of ourselves. So it's outer focused to the exclusion of being inner focused is really the way of saying codependency. Codependency is outer focused to the exclusion of being inner focused. The fourth thing is it's what we call a disease of lost selfhood.
Mm-hmm.
Do you want to comment on that?
Well, the disease of lost selfhood, what is selfhood,
Mm-hmm.
right? Selfhood, my understanding of selfhood is who I am as my authentic true self.
Correct.
Right. And if I'm not, treated that way, that means my true self is not valued and is not, accepted. Then I develop, a condition called, false self,
Mm-hmm.
right? So that means I'm going to do whatever it takes for me to be accepted
Mm-hmm.
in the group that I am, mainly in my family of origin.
Right.
Right. So what that means that, I'm not going to focus on who I am, what are my desires, what are my wants, what am I thinking, and what do I need, and have the courage to discuss them, because I know that in a few times that I have attempted to do that, they have been ignored or they have been rejected.
Mm-hmm.
Right.
Mm-hmm.
So fear of being abandoned causes for me to accept that false self that it is imposed on me as who I should be. Mm-hmm. in the eyes of my caregiver and my environment. I operate from that perspective, because that perspective I'm in. If I hold that perspective, I'm in the game, I'm welcomed, I'm accepted, and I get some of my needs met. Mm-hmm. Right. Mm-hmm. But the key point is I'm not getting all of my needs met. Mm-hmm. And that's when I'm not accepted as who I am, by the original of my authentic true self. That means my originality is not welcome, is not recognized.
Mm-hmm.
Right? Then I believe, then I internalize that there is something wrong with me,
Mm-hmm.
that I'm not recognized,
Mm-hmm.
that I'm not welcome as who I am. And this is such a hard concept to accept, but a child can do that. A child is able to make meanings for himself or herself, that uh, who I am, it doesn't matter. What I need to be matters,
Mm-hmm.
right?
Right.
And then so that's my beginning of becoming a codependent. So I'll do to please people, I'll do things to please my parents.
Yes.
Right.
Yes. Yeah. I'm trying to think of who it was. Somebody famous in the codependency field coined the term human doings.
Human doings, yeah.
Yeah, yeah. It'll come to me who said that. But yeah, a human doing means that the parents paid more attention to the behavior
Right.
than the why to the behavior.
Exactly.
Right.
Yes.
So, and the why to the behavior it has to do with the child's inner life.
Yes, exactly. When a child is born, usually parents, the first thing they say, "Oh, I'm gonna teach you this. Oh, you're gonna be the best surgeon. Oh, you're gonna be the best this. Oh, I'm gonna teach you to do this. I'm gonna take you to this place. I'm gonna make sure you're so beautiful." So they come up with all these very well-wished, concept for the child,
Mm-hmm.
right? Rather than say, and here's the problem, I want to get to know you.
Mm-hmm.
I want to know, your personality. I want to know what you're thinking. I want to know, how I can connect to you. I can't wait for you to talk, so we can talk about what you want. See, this is parenting.
This. Well, that's a form of parenting.
That's a form of parenting, to allow the child to be who the child is,
Right.
rather than for us to make the child into what we want the child to become.
Correct.
Which is that's when we say disease of false, lost selfhood.
Mm-hmm.
We help the child to lose their selfhood.
Yes. Yeah. Yeah. When we ask the question, uh, what when we say to ourselves, who have we here,
Yeah.
rather than I'm going to make you a success.
A success.
See?
Yes.
Because,
it's like the child, it is as though they are our trophies.
Yes.
They're
Yeah.
not our trophies.
Right.
Yeah.
So that's the fourth part, is the disease of lost selfhood. The fifth aspect of codependency is that there are boundary distortions.
Mm-hmm.
A boundary distortion means, where do I end and you begin? So if I am married to a woman, and that woman is having a hard day, for whatever reason, maybe she's not feeling well physically, maybe she's struggling with some emotional difficulties, maybe somebody that she knows is sick, and she's having a hard day. Do I have to have a hard day as well in order to feel like I'm loving her? Does she expect me to have a hard day? Do I expect me to have a hard day because she's having a hard day? And that's what we're talking about when we say boundary distortions, because it's in a healthy environment, each person is not dependent on the other person's mood for how they feel. So you can have a hard day and I can feel okay, and I can have a hard day and you can feel okay. Now, does that mean that we don't care about the other person's feelings? And that's usually where the boundary distortion becomes blurred. Because if you don't, people who have the boundary distortion say, well, if you'd really cared about me, you would be as upset as I am about this.
Right.
See, and that comes from the boundary distortion.
Yeah.
When we care about somebody, it doesn't mean that we join them in the way in their feelings about what they're feeling, but it does mean that we let them know that we can understand how they're feeling, because the truth is we can all understand all the feelings by the time we get to be an adolescent or an adult. We can understand what it feels like to be sad. We all know what that feels like. We may not feel sad about the same thing that our friend or child or partner is feeling, but we know what that feeling is.
Exactly.
And so we can join with them in letting them know, I know how that feels. I don't know exactly how that feels, perhaps because I don't understand exactly your particular situation, but I can get a sense of what you're going through, and
Yeah.
and that's called empathy.
Exactly, exactly. And I know that we are getting close to our commercial break. I just want to say boundary distortion for me starts at the time when we decide to make the child to make them into something we want
Mm.
rather than
Mm-hmm.
allowing them to be who they are.
Mm-hmm. Good point. Yeah.
Right.
So we're having to take another mini break. We're inviting you again to call us 951 and we will see you in just a few moments.
Join us. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart to Heart program at KMET 1490 AM, ABC News Radio Live. We are talking about codependency and what creates codependency with Dr. Robert Jaffe. And we talked about the last thing we said before commercial break was the word empathy.
Empathy, right. And so empathy, we were talking actually about the different characteristics of codependency. The last one that we commented on was it's a personal boundary distortion.
Right.
And what a boundary distortion means is that I'm not sure where I end and you begin. I feel more like we're not two separate people, that we're two halves of one person. In fact, our culture actually um, it adds to that belief that that's what true love is, where you're just one of one mind, one heart, you know.
My better half.
Yeah, and
My other
my
half.
other half or my
Yeah.
better half, right, right. Rather than two separate people who, when they come together, they create like a third entity, which is bigger than the both of them.
Yes.
Yeah.
I remember when you and I went to Arizona for that seminar that we did go to,
Mm-hmm.
And then I was just walking, along the Bryant line in Grand Canyon, and I was told, "Where is your other half?" And I was like, "What?" I mean, it just hit me. For a moment, I had to think about it. What are they talking about, right? So apparently when they saw you and I, going to the seminar, the assumption was that maybe we have a relationship of, that kind. And then when you were not with me at that time that I was walking around, and they assumed that, they can say, where is your other half,
Right. Exactly.
And it took me like quite a long second to kind of digest that, where is your other half. And for me, that was such a strong concept and boundary, actually crossing boundaries for people to have that assumptions that
Right.
and then the fact that I have another half. What happened to all of me?
Yeah.
So I had to digest all of that, and it kind of threw me off of the whole situation that I was there, and I think I shared that with you.
You
right?
did. Yes.
Yeah.
Yeah. So anyway, so it's a boundary distortion. That's the fifth element. I told you that we're working out of Charles Whitfield's book Codependence: Healing the Human Condition, and so the sixth one that he brings up here is a feeling disorder, and that and so what does that mean? It means that at the core of codependence are feelings of profound emptiness. Emptiness, which then manifests as low self-esteem, which also manifests as feelings of shame, fear, anger, confusion, and numbness. So those feelings, if you are having a lot of those feelings, the chances are that uh, that that you are suffering with codependency, and that there is treatment for that. So but that's the sixth element, is it's a feeling disorder, and it manifests in those ways, as a feeling of profound emptiness, and then people try not to feel that emptiness, and they defend against those feelings, which then creates even more problems because they don't recognize that that's what's at the core.
So I think that could be one of the fundamental aspects of addictions.
It is one of the fundamental aspects of addictions, is that it's a feeling disorder, and there's a feeling of emptiness underneath it, so that when you use your addiction, whatever the addiction is, it could be a process addiction, which is what gambling and codependence are, or it could be a chemical.
Eating disorder also is a part of it.
Yes, yeah, an eating disorder, and it could also be a chemical addiction. An eating disorder actually, and actually all addictions affect the brain and affect the chemicals within the brain. So eating disorders do as well. We're talking today more about codependence, and so what we can say is that it changes your brain chemistry. The belief that you're not enough, the belief that that without someone else you are nothing, and you don't matter. And so these are all elements that together form codependency. So that's number six. The seventh one is one that, all of these actually we could talk about for a long time, but the seventh one is the one that most people recognize. Oh, something's wrong here, and that is it produces relationship difficulties with oneself and with other people. And so the relationship difficulties has a lot to do with the belief that you need something outside of you to make you feel good and fulfilled. And so the relationship then that you form is often with another person who is also suffering with codependence, and you make this unconscious or subconscious contract that I will fulfill all of your needs if you promise to fulfill all of mine. Mm-hmm. And so, Dr. Rashidian, what's wrong with that conflict, with that contract?
Well, I think in my earlier program at 3 to 4 p.m., we talk about, value system and expectations, mm-hmm. right? Mm-hmm. We talk about that, whether we are aware that we are holding our own value system, or whether we are holding on to an imposed value system, we develop expectations, mm-hmm. right? If we are holding our own value system, then those expectations, actually we won't have expectation. We are able to just talk about what we want, mm-hmm. right? And mm-hmm. how we feel. But if you're holding, imposed value system, that's when expectation happens, because there is a lack in the lack of something within our subconscious, mm-hmm. that we expect somebody else to fulfill that for us.
Right.
Right. And right. That's part of codependency. Mm-hmm. Right. So whether and then for me, for anybody not to have that imposed value system, we need to be our own authentic true self. Mm-hmm. So if we are that, then, we are able, like I said, to talk about what makes me happy, what I want, what makes me joyful. And I am able to relate to my partner. I am able to understand, my partner. But if I'm not that, then the expectations that I have are going to be kind of a self-sabotaging behavior.
So when the codependent person enters into that relationship, right. saying you're here, you're going to fulfill all of my needs and desires,
right.
and the other person is saying the same thing, those expectations are unrealistic.
Unrealistic. Like I told you, in the prior program, I said I have this client that, he believes that if he's not happy sexually or in his sex life, it's his wife's fault.
Mm-hmm.
Right? So when I told him that, the answer is within him and not the wife, he's the one that, he has actually codependent attitude and behavior,
Mm-hmm.
and therefore expectations that, he projects all those negativity onto his wife, and therefore
Mm-hmm.
he's not getting, what he believes it are his needs. And then above that, his wife is not responsible for for those unrealistic expectation that he has, and he needs to understand where they're coming from, and then to resolve that. So that's where I'm helping him. So that's a good example of codependency, and having expectations that are caused by that remember you said that empty
Emptiness.
place, that emptiness.
Yes.
Right. So that emptiness needs to be filled with something,
Mm-hmm.
and that something are unexpected, or expectations that they are not going to be provided and fulfilled by somebody else's change of behavior. But
Right.
the person needs to learn about those expectations and to see why they are there, so then he or she can fulfill that emptiness with something that's really truthful to themselves.
Right.
Not to their false self.
Right. Right. So what fills our emptiness then, if it's not another person, and if it's not something outside of us, then people say, well, okay, so what does fill my emptiness?
Is the view of myself and what works for me. So we need to get to that part. That's the core part. Who am I?
Who am I? And also, do I matter
Yes.
to myself?
Yeah.
And why do I matter to myself?
But we're talking now about self-compassion,
And
right?
self-compassion, right?
Yeah.
Right. So recognizing that the way we treat ourselves, and everybody does this, everybody treats themselves according to their level of self-esteem at that particular moment in their lives. So if your self-esteem is down in the dumps, and most people go through life, and I certainly have, with higher and lower self-esteems, based on circumstances that I'm in, and so when things aren't going our way, let's say, and my self-esteem isn't good, then my thoughts are more about what I'm not.
Exactly.
I'm
Yes.
not smart enough. I'm not, I didn't save enough money. The word enough is pretty ubiquitous when we're talking about low self-esteem.
And yeah.
I've worked with models that, most women would die for their hair or their breasts or their figure or their skin. And the model is like, well, look, I have this little mole here, and I've tried to get rid of it, and it's not going away, and I can't sleep at night.
The interesting you talk about modeling. This morning on the news, I heard something about Victoria's Secret company. So Victoria's Secret is famous for, having all these, exceptional, models who are, introducing the exceptional lingerie for women, right? And so for years, women try to fit in that style, to fit in those lingerie. So through diets, through variety of, creative things, they did that. But they suggested that starting 2020, they're putting all that behind that. They're looking at realistic women. And for me, that was a happy news.
Well, we'll see how well it does.
Yeah.
Yeah.
But
it's definitely a step in the right direction.
Yes.
Yeah.
Exactly.
So we're going to need to stop in a moment. We really appreciate your listening. We would love it if you would contact us, let us know about it, and please remember, when we say at the end, all you need is love, it sort of sounds corny, but it's the truth. Love is really the only thing that satisfies us as human beings, and it's the only thing that can really make us happy in the long run.
Self-love is the starting point.
Yes. So remember, please take good care of yourselves, be kind and loving to the people around you. And we look forward to another program next Thursday, 3 o'clock, with Dr. Rashidian on sexuality and relationships, and 4 o'clock with myself and Dr. Rashidian on trauma and addictions and codependency. And have a great weekend. And remember,
all you need is love.
all you need is love. Okay. Talk to you soon.
Bye-bye.
Bye.